All right, let's unlock some of those dental mysteries, shall we? Today we're diving deep into malocclusion.
Ooh, malocclusion. Sounds a bit intimidating, doesn't it?
It does, a little, but I think everyone's probably heard it before, maybe on a dental chart, maybe just in passing. But what's it really all about?
Exactly.
It's more than just crooked teeth, right?
Absolutely. It goes beyond just the cosmetics.
It really impacts how your upper and lower jaws, how they fit together.
Yeah.
How does that impact your bite? How's your dental health?
Yeah.
Even your facial structure. It's all connected. I remember back in high school, I had this friend, and he had a seriously severe overbite.
Oh, wow.
And it wasn't just, a look. He had trouble chewing, even speaking clearly sometimes.
Oh, I see.
And turns out it was a classic case of what we're talking about today, Class II malocclusion.
Interesting. You know, it's fascinating how malocclusion is actually classified. You've got class I, the most common one. Bite's generally okay, but there might be crowding or spacing issues. Then you've got class II, where the lower molars are positioned too far back compared to the upper molars.
Creating that overbite.
Exactly, that overbite look. And then, of course, there's class III, the opposite, the lower jaw's sticking out too far.
Right.
But for today's deep dive, we're really going to unpack class II.
Yeah, let's focus on class II.
Because it often presents the most, noticeable challenges.
Absolutely. So let's break it down, class II malocclusion. What sets it apart from the others?
The key really lies in the relationship between the upper and lower molars. So in class II, like we said, those lower molars are set back compared to the upper molars, giving that overbite.
Right.
But even within class II, there are two divisions. You've got division 1, where the upper front teeth, those incisors, they stick out significantly.
Protruding.
Yeah. And then division 2, where those upper incisors are actually tilted inward.
Oh, okay.
But here's the really important part. Class II malocclusion, it can be caused by dental issues, meaning the positioning of the teeth themselves, or skeletal issues. Oh, interesting.
Meaning problems with the actual structure of the jaw.
So it's not always just the teeth. Sometimes it's the jaw itself.
You got it. Determining that root cause is so vital for deciding on the right treatment.
That's a game changer. Okay, so let's unpack this a bit. Let's start with dental class II malocclusion. So this is where the teeth are misaligned.
Right.
But the jawbone itself, structurally, it's fine.
Exactly.
Can you give us some examples of what that might look like?
Sure. So one common example is maxillary dental protrusion.
Maxillary dental protrusion.
No, it's a mouthful. But basically, the upper front teeth, those incisors, they just stick out too far.
Okay.
Leads to that noticeable overbite. But again, it's the teeth and gums that are positioned incorrectly, not the jawbone itself.
Okay.
Another example is mesial drift of the molars. Essentially, the molars have shifted forward from their proper position, causing that class II relationship.
Got it. So what causes these dental misalignments? Are we talking genetics, bad habits? What is it? Could be a mix of things. Sometimes it's congenital, meaning they're born with missing teeth or teeth that just erupt in a weird pattern.
Okay.
Other times it's premature loss of baby teeth. If those baby teeth are lost too early, the remaining teeth kind of drift into that open space, throws everything off.
Makes sense.
Yeah.
Now, what about the skeletal side of things?
Right. Skeletal class II.
That's a bit more complex.
It can be, yes. This is where the size or the position of the upper and lower jaws, they're mismatched. This can happen in a couple of main ways.
Yeah.
We've got mandibular deficiency, meaning an underdeveloped lower jaw, too small or positioned too far back.
So the lower jaw didn't quite catch up in development.
Exactly. And this can lead to some noticeable facial features, like the chin might appear weak or receded.
Oh, okay.
And the upper teeth protrude even more. And because that lower jaw is set back, it can also be hard to close the lips properly.
Right.
We call that lip incompetence.
Lip incompetence. Got it.
To diagnose this, we use a special X-ray, a cephalometric analysis, to measure the angles and relationships between different parts of the skull.
Wow, that's some serious detective work. Okay, so that's mandibular deficiency. What's the other way the jaw can cause class II?
The other scenario is maxillary excess,
Okay.
meaning the upper jaw is overdeveloped, either vertically or horizontally, sticking out too far compared to the lower jaw.
So it's like trying to fit a big drawer into a small cabinet.
Exactly. Doesn't quite work. This can lead to a few issues.
Like what? Paint us a picture.
For one, it can worsen that downward and backward rotation of the lower jaw, leading to a gummy smile. You see a lot of gum tissue when they smile.
Oh, right.
It can also make that lip incompetence worse. And because the upper jaw is so prominent, the upper incisors are very noticeable. The lower face height might appear increased. makes the chin look less defined.
So a small lower jaw or large upper jaw, it ends up being that same class 2 misalignment.
Exactly.
Interesting.
And here's where it gets really interesting. Even with these skeletal differences, the body tries to compensate. And it's the teeth that take on the challenge.
Compensate. How does that work?
So those lower incisors might start to protrude forward, or the upper teeth might become crowded, trying to achieve a somewhat functional bite.
Okay.
But here's the thing. These compensations can mask the underlying skeletal issue.
Ah, so it's tricking you.
It's like putting a Band-Aid on a broken bone, you know?
Yeah, right.
It might look okay on the surface, but the problem's still there.
It makes sense. So identifying the root of the problem is critical for successful treatment.
Absolutely. And that brings us to treatment approaches. And the good news is we have several options available today,
Okay.
each one tailored to the individual and how severe their malocclusion is.
So let's dive into those treatment options. I know braces are a common solution, but what are some other approaches?
You're right, braces are often part of it, but it's not the whole story. We have three main approaches: growth modification, dental camouflage, and orthognathic surgery.
Okay.
The best one for a person really depends on their age and the severity of their malocclusion.
Okay, break those down for us. What's growth modification? Sounds kind of sci-fi.
It's not science fiction, but it is amazing. Growth modification uses a child's natural growth to guide how their jaw develops. It's most effective in kids who are still growing.
Right.
It involves using things like headgear or functional appliances to kind of influence how the jaws grow.
Headgear. Those bring back memories. Weren't those a bit uncomfortable? Do those really reshape the jaw?
Headgear, yeah, it's got a bit of a reputation.
Yeah.
They consist of curved wires that attach to the upper arch wire of braces, and they connect to a strap that's worn around the head or neck.
Okay.
It's like a gentle tug of war, encouraging the lower jaw to catch up while restricting the growth of the upper jaw.
Oh, interesting.
And yes, they can be very effective at reshaping the jaw during those critical growth periods.
So it's like guiding the jaw into a better position. What are some different types of headgear that are used?
There are a few different types, each one designed to apply force in a specific direction.
Okay.
You've got cervical headgear that fits around the neck. It directs force kind of downward and backward.
Okay.
And then occipital headgear, which goes around the head, directs force upward and backward. Sometimes we use a combo of both for more control. It all depends on what the individual needs and the desired outcome.
It sounds like precision is key here. How do orthodontists know what type of headgear and how much force to use for each person?
That's where the art and science of orthodontics really come together.
Right.
We consider things like how severe the malocclusion is, the person's age, their growth potential, and the specific movements we need to achieve.
Right.
It's a delicate balance, and monitoring carefully is really crucial throughout the whole process.
Wow. Okay, so that's headgear. What about that second approach you mentioned, dental camouflage?
Okay, so dental camouflage is all about working with the existing jaw structure.
Oh.
It involves adjusting the positions of the teeth to compensate for that underlying skeletal discrepancy. Think of it like rearranging furniture in a room to make the best use of the space you have.
So instead of changing the jaw, you're repositioning the teeth to create a better bite.
Precisely. It might involve techniques like extracting premolars to make space or retracting those upper front teeth to reduce that overjet. The goal is a bite that's functional and looks good, even though the skeletal issue is still there.
Right.
It's important to remember that dental camouflage is a compromise.
Okay.
It doesn't fix the jaw discrepancy itself, but it can be a very effective solution for a lot of people.
It makes sense. Dental camouflage sounds great, but are there any downsides to just adjusting the teeth without fixing the jaw?
That's a great question. While it can be really effective, it's important to weigh the potential drawbacks. For example, if the discrepancy is really big, extracting teeth to create space can compromise the long-term stability of the bite.
Ah.
And sometimes the teeth might be more likely to shift or relapse over time.
So it's a balancing act, like most things in life. We've got growth modification for growing kids, dental camouflage for adults. What about that third option, that orthognathic surgery? It sounds pretty intense.
It is a more involved procedure. We reserve it for those severe cases where growth mod or dental camouflage just aren't enough to correct the problem.
Okay.
Orthognathic surgery literally reshapes the jaws to fix that misalignment.
Wow, they actually reshape the jaw. What does that procedure involve?
It's a surgical procedure, usually done in a hospital. The surgeon repositions the jaw bones. They might use techniques like a sagittal split osteotomy, which involves cutting and repositioning the lower jaw.
Okay.
Sometimes bone grafts are needed to add volume to the jaw, or portions of bone might be removed to reshape it.
Wow, that's a lot to take in. It sounds like orthognathic surgery is a major decision.
You're absolutely right. It's a major procedure, requires careful consideration.
Yeah.
The decision to have surgery involves a really thorough evaluation by both an orthodontist and an oral and maxillofacial surgeon.
So it's a team effort,
Yes.
like most things in healthcare. This has been so insightful. We've covered so much, from the types of class 2 to all these different treatment options. I feel like I've gotten a crash course in orthodontics.
It's a complex topic, but understanding the basics can be really empowering for both patients and their families. It helps them make informed decisions about their dental health
Absolutely.
and explore what options are available to get a healthy, beautiful smile.
Well said. Stay tuned, listeners, because in the next part of our deep dive, we'll explore these treatment approaches in more detail, starting with a closer look at those functional appliances.